All right, guys, I was approved for surgery. Yay! So my surgery is scheduled for June the 12th. If you're watching this the same day I posted it, that would mean my surgery is tomorrow. So today I'm doing my pre-op liquid diet. I only had it for one day. So I am excited. I'm ready to go. I'm just ready. I'm so ready. So anyway, so the rest of this video is going to be me meeting with my doctor, so you can get some insight from him as far as what I can and can't do. But before I do that, I want to show you my grocery haul for pre-op, so let's get into that. All right, so don't mind the sound of the washer in the back, but this is my haul for pre-op. I have a circle, so I have some cartridges for that. I have a thing of coffee. At first I was told I couldn't have caffeine, but when we had our appointment on Wednesday for pre-op, they told us we could have caffeine. So I have that, and I have a can of decaf coffee because that's what I had prepared to use. I have some caffeine-free tea that I purchased because I thought I couldn't have caffeine, some flavor packets. So I have some chicken and some beef bone broth. They accidentally gave me a regular chicken broth back here, so I'm going to actually drink that today while I'm on my all-liquid diet. I'm also going to drink this Gatorade Zero today. So I have some sugar-free ketchup. I use this anyway, so I have that. And I accidentally got some protein shakes, the Equate version. I ordered something else and they gave me these. I have some light mayo. I have some water. 3 of these are drinking waters and 1 is a distilled water for my coffee maker, because I only use distilled water in my coffee maker. I keep hearing about the Snapple apple, so I had to get one of those. And I also got the kiwi and strawberry flavor. I got quite a few of the protein waters, so I have this one, and then I have this one. This is the orange mango, and I think this is the strawberry something? Strawberry watermelon. I also have the protein waters with caffeine in it. I'm going to drink one of these today, and then I'll have the 2 left. I also have the cranberry juices, the diet ones. So this is the cran pineapple. And this is, which one is this? I think it's mango. Yeah, cran mango. So I have that. I also have some Isopure protein. I didn't want the protein powder that my doctor's office had, so I got this from Amazon. And then also today they told us to drink, we can have soda. So they said either the Diet Sprite, the Zero, or the Diet 7-Up. So I have that. I have these to start off my soft foods, because my soft foods actually starts on week 2. So I have that. I have these that I already started taking. These are the prebiotic probiotics for Ollie. I've been liking those. So this is, oh, I forgot I have some peanut butter right here. I always keep this type of peanut butter. It's the no sugar added peanut butter. So this is my haul for the first week after surgery. Everything I should be able to eat and drink. Well, everything, I'm on liquid, so it's not eating, but everything I should be able to drink. I also have a case of Premier caramel that I didn't put up here, and I also have some popsicles. Okay, so here are the popsicles. I have the sugar-free junior pops, and then I have some no sugar added outshines, and then I have some regular no sugar added, sugar-free tropicals. So those are my popsicles that I will be living off of. I can also have popsicles today on my pre-diet. So yeah, that's pretty much what I'll be eating and drinking for the next week or so. And like I said, the Premier Protein, I also have 2 cases of water on deck and ready to go. So I think I'm pretty much good to go. So without further ado, let's get into my doctor's portion of this video. I hope that you enjoy it. Don't forget to like, comment, and subscribe. And here we go.
Ready to do it?
Yeah.
All right. Well, I know they. What questions do you have about all this first, and then I'll talk to you about some.
Okay, so I did have a question. It's a procedure called cavitation, where they use ultrasonic waves to like sculpt your body. Why are you
No, I'm just looking.
You gave me that slow.
No, I'm just trying to figure out where you're going with this. Yeah, I've heard of it. Yes.
Okay, so I want to do that after surgery, so I'm trying to figure out how long I have to wait before I have it done.
I don't think there's. Well, you're not going to want to get jostled on your abdominal wall right afterwards. Yeah. As you start losing weight and you want to try to tone things up, I don't think there's a invasive, but I know just the ultrasonic
Yeah.
Technologies that they have. I don't think there's a specific time you have to wait. You can try it whenever you want to.
Okay.
As you go, if you want to get on a program, those are more questions for them about.
Well, no, I have one to do it at home. So
you got a home one?
Yeah, I bought it for myself for Christmas in 2021.
Really?
I like gadgets.
I don't know how well. I'm curious to see how it'll work. But you're welcome to try it. I don't think it's not gonna affect anything we do.
Okay.
So you can try it. I would not do it anytime the first month, say, after the procedure, just to let things heal and your abdominal wall heal and all that. And then you're on this diet plan you need to be on after the surgery that you're on liquids basically for a week, and then you can start some pureed soft foods after that, and just follow the protocols for the healing aspect of it. But doing the things for your abdominal wall with the ultrasound are gonna be fine.
Okay, and then my other thing was about red light therapy. I assume I can do that like as soon as my bandages come off.
Yeah, I mean I would let the body heal a little bit first. Typically, we tell people to wait for Mederma and all these other scar creams. I know the red light therapy. I know I'm well aware of it. So we typically tell them for the scar cream stuff, wait about 3 to 4 weeks.
Okay.
I'd probably do the same thing for the red light therapy, just because it's gonna. I don't know. It's a little unclear how it's gonna affect scarring and stuff, but I know it's designed to help it. I know there's a lot of data about it. There's people using it burns.
I used it before.
Yeah, exactly, for all kind of things. I don't think it's gonna hurt it at all, and so but I would just give it this few weeks to just heal. Kind of on its own, and then you're welcome to start trying that stuff about 3 weeks out.
Okay, yeah, I used it before because I had a cut and then it actually healed it nicely. You can't even tell that I had it. So
there's all kind of it's one of those things they're trying to figure out all the uses they can possibly do with it.
I got it for my face, but it worked for other things.
Yeah, I don't think it's gonna. It won't hurt anything at that point. So you're fine. You're welcome to try it and hopefully it'll help it out. Yeah.
Okay. All right. So the next thing was I was told to let you know that I do take digestive enzymes and to see when I can take those enzymes again.
That's fine. How big are the pills?
They're big.
That's the problem. So most of the supplement kind of things people take, you're just not. It's just they're big, and now you can take pills right away. I have people that come in and they're on 20 medicines. And they got to take 16 of them still after the surgery. You could take pills after the surgery. You just can't take 16 pills at the same time. So I don't know is it a capsule or can you break it up, or is it?
It's like a big old horse pill. It's a
solid pill.
Yeah.
I mean, can you break it up at all? Is it something that
it's really
is it tablet?
It's like the 1-a-day multivitamins, but it's bigger than that.
Yeah. It's just not gonna be comfortable. So look, if you feel like you need it for digestion, in other words, you're having some digestive issues with booster bowel movements or something, and you feel like that helps. I'm fine with you taking it. It's just they're not easy to take big pills. It's just not gonna feel comfortable. And so typically I try to get you just wait a couple weeks. That's why we even put you on chewable multivitamins. Usually at 3 weeks, I'm like, you can go to a pill if you want to, just because they're big.
Yeah.
But as soon as you feel like
they're hard to take even on a normal
basis. I just don't think you're gonna want to do it right away. I would try to find a liquid alternative or pill
I'll try to find something
chewable alternative until you can get 3 or 4 weeks out. You should be able to probably take that without issue, and you can do it sooner. I would just go slow with it.
Okay.
Just take one, see how you do. If you can get a pill cutter and break it in a few pieces, that would probably be better and more tolerated better than these big pills. You're gonna feel like it's gonna get stuck. So at the beginning, the difference in somebody who's has I make this. We have a standard size. We use bougies, and you probably may have read about that if you look into how we do this, and it how we calibrate the tubes. Or calibrate how big to make a sleeve. We use these calibration tubes that you put down when you're asleep. Yeah, and so at the beginning when we first started doing these, we were like, well, how big should we make this? Should we make it? You don't want to make it too small. You can't eat. You don't make it too big. You won't lose enough weight. What you want is just right. That was a big question. How is just right? How do we do that? And so we came up with the kind of guidelines of and standards that most people use of how big to make the sleeves when we create them. And I can make one, and some person can barely get water down, and I can do that same size, and other people think I made it too big because they're eating liquids and eating soft foods a week out. And they're like, "Did you make mine too big?" Both of them actually have the same size sleeve. It's just how much swelling you have after the surgery.
Okay.
If I go around and punch everyone in the arm, I'd get arrested. But and people might, it would be very popular. But if I did that, some people would have terrible bruising and swelling and everything in their arm, and other people would have mark on it, right? Some people just bruise and swell differently. That's the same thing on your insides when we do a surgery. Some people swell up a lot, some people don't. Typically that swelling takes a little while to go away, but that's why there's such very differences in outcomes initially with this, is because how much swelling you have. And so if things are going down okay, you can probably get back to that tablet a little quicker. If it's barely getting liquids in, I wouldn't go take a huge pill. You're gonna get stuck. You'll throw it up. It's just, you don't want to do that. So.
Okay. The next thing was about ibuprofen, because I do take ibuprofen. It helps. I don't like to take the medicines that I was necessarily, please do not give me a lecture. I don't like to take all of my lupus medicines. So I've been taking ibuprofen because Tylenol works differently for me. And I know that there's like some hesitation on taking ibuprofen, but I don't take it very often.
Yeah. So the deal with ibuprofen, so we try to get you to stay away from ibuprofen if you can, but the sleeve actually has the sleeve has the least amount of issue with ibuprofen products.
Okay.
And I have people that can't get out of bed unless they take their Aleve or ibuprofen. I'm like, well, take your Aleve or ibuprofen so you can get out of bed. I need you to walk. I need you to do the stuff you need to do. I'd rather you find an alternative than ibuprofen initially. So all those medicines can cause ulcers or irritation of the stomach lining. They can cause that before the surgery. Right. They can cause it after the surgery. The sleeve has the least amount of issue with the NSAIDs, the class of medicines that are Aleve and Advil and those medicines. So the sleeve has tends to have the least amount of those issues, but you can still have issues. And so if it's just every once in a while, what I would typically do you take, you don't take Prilosec or anything like that regularly, right?
That was also on my list to ask you about that.
So what I would do is to help, if you're going to take ibuprofen, you need to take it from time to time. Hopefully the whole goal of this is that your joints hurt less as you lose weight. You don't need ibuprofen as much. But I get it's a catch-22 right now. We're like, well, we need you to, you got to lose the weight first, and we got to do the surgery, but you can't take the meds. So take as little as my recommendation, take as little as you can do. But if you need it, it's okay to take it. But if you're going to take it from time to time, get on something that's going to decrease the incidence of having an irritation of the stomach. And so I would get on a Prilosec regularly for now. Try it over the counter one at first. If you're having issues with food going down or your irritation of the stomach, or you feel like you're getting early ulcers or gastritis kind of symptoms, the ibuprofen products are making that worse. And so you need to back off the ibuprofen, find an alternative for it, Celebrex at least, or some other form of pain meds. I'm going to leave it up to you and your lupus doctors about what to take for your medicines. The whole goal of this is that we are decreasing. If you're going to deal with lupus flare-ups down the road, we don't want to have to throw weight on top of it.
Right, and that's the issue.
There's certainly increased risk on these immunosuppressants with any surgery, and you'll have some increased risk. But we do patients on these meds all the time. It's just you got to be just stick to the diet plan. That's the main thing. And from the ibuprofen standpoint, we just don't see as like the gastric bypass. We see a lot of ulcers with taking NSAID. That is more of a problem. Okay. The sleeve, you don't see it as much, and so I feel a little better about people that have to take it. This issue comes up all the time, as you can imagine. A lot of our patients have arthritis from even if it's just osteoarthritis, just from the weight and everything. They can't get out of bed without taking these things. I'd rather them take it, but it's increasing the risk of ulcers. We got to do something to decrease it, and certainly if you start getting any symptoms, we got to back off. Okay. So it's just something that we prefer you not to do, but if you have to do it, we understand. It's just we got to do something to decrease risk, and then you just got to back off of it and sort of have issues. So I would just try to minimize it, and then get on an over-the-counter Prilosec for now. Go ahead and start that today.
Well, that was going to be one of my questions. If you could put me on a prescription.
Yeah, I can put you on a prescription.
Because my concern is the fact that I already have to take over-the-counter meds now for reflux. Yep. So I just wanted to, and my daughter knows I'm at the doctor's office. I don't know why she's calling me.
You need to answer this.
hopefully I can. She won't call me back to back. Ma'am, I'm at the doctor's office. I told you I was going today. I gotta call you back. I'm in here with the doctor.
Hi, doctor.
Hi.
Hi, baby. Bye. Kids gotta love them.
Gotta love them. I have 4 of them, so.
So yeah, that I was gonna ask you about putting on because I already have to take some medicines and I've had ulcers before, so I just wanted to be on something for the first few weeks while I'm.
Yeah, no, I think it's gonna be helpful to, and I would start it today.
Okay.
So we'll call in something if for some reason insurance is giving us hassle about approving it and everything. Then try to start the over-the-counter stuff until we get this set up. But I think it should be fine. Now, I do think we need to be on something to protect your sleeve. And I think it's with that history especially. Let's go ahead. We'll call that in. So I'll have Heather call that in. We'll just take it once a day for now.
So then my next question is about taking collagen because I take collagen now daily and I put it in my coffee. When can I start that back up?
Right away, especially if it's so it absorbs in the coffee and that's fine.
Okay, and then the last one is with VCAAs. I would assume I can start those when I start working out, which is what, week 6?
Yeah, we wait till about 3 to 4 weeks before. So 3 weeks you start easing into stuff. 4 weeks you're kind of fully cleared.
Okay.
And then at that point you're fully cleared.
Okay.
So that'll be fine at that point.
Okay. And I was told to stay off the Peloton at least for a month.
Well, yeah. So the first month I just want you walking and don't do anything more than walking speed. Everyone's like, can I do this? Can I do that? I'm like, listen. I'm just trying to teach you to take it easy.
Megan was like, no Peloton.
No Peloton. I agree. No Peloton for a month. And look, I love that you're asking when I can get back on the Peloton. That is great that you're asking that. It's the right question. I just don't want you to. It's the only time you'll ever hear me say don't exercise is right after a surgery, but I do need you to heal. We don't want a hernia. And so we're these things are little tiny incisions. I got to make one of these incisions in particular big enough to get the stomach out. And so that's healing. And so you strain too much, you're gonna pop a hole in the muscles and cause a hernia. And so we have to let things heal well. And so if you just let it heal up these first 4 weeks, you should be fine. But you don't want to do too much and use your core. When you're doing all that stuff, you're putting strain on your core, even though you're using your legs, but you use your whole abdominal. I don't think you're gonna feel like doing a Peloton for a few weeks anyway. But I love that you're wanting to get back to it as soon as possible. But just give it that 4 weeks, and then after that, you can do it.
And I was still running too. Now here's
walking.
But here's my question about this. I have a question about the walking too, because I walk with my walking group and we do 3 to 4 miles.
So I want walking, activity walking, not exercise walking. So look, again, I don't.
You're killing me, Dr. Johnson.
I know. I don't mind you walking, even if it's for 3 miles, as long as it's. I don't know if you're helping, if you're out of breath, if it's
I'll do a
straining.
stroll. I'll do a nice little stroll.
Yeah, walking I don't mind. It's just I don't want you straining, and I don't know how hard it is for you to do all that. I'm just like, take it easy for about 4 weeks.
Running. I
definitely do not want you running because you're just going to aggravate it. You'll get a hernia if you do too much. So just take it easy for these first 4 weeks. Everyone's always like, can I mow my lawn? Can I do this? I'm like, I don't know how big your lawn is. I don't know how long and hard it is. Just take it easy about 4 weeks.
I'm horrible when it comes to like surgeries. Like even when I had my C-section, I was doing stuff I had no business doing. And my ex-husband was like, what are you doing today? I was somewhere. That's just my personality. I can't.
I love it. I love that you're wanting to get back to it and not wanting to stop. I just need you to hold off for about 4 weeks. You're not going to feel like it the first couple weeks anyway.
Yeah.
You're just going to be recovering from the surgery.
Oh, and that was the thing. So I know that you have to make a bigger scar. Here's a strange request. Can you use my gallbladder scar so we're not adding?
I will always try to use the old incisions if I can.
Okay.
I can't promise. There are going to be some new ones, and sometimes they're just not in the right spot, and I can't use them. If it's anywhere close to where I'm putting the incisions.
Well, my gallbladder scar is up
I know,
here.
that's not really one we usually use, but I will, if I can move something safely without, the first goal of the surgery is to do a safe surgery for you, and then the cosmetic secondary, the whole scars are secondary, but I get it. I don't want to make a scar to make a scar just because it's a little off of where I can usually move things around a little bit, but I have to be able to do it in a proper way. And so if and the gallbladder was on the opposite side of where we're operating, so I can't. But some of the scars I can often use several of them. So
Yeah, because I've had a couple of laparoscopic
Yeah.
surgeries, so I have plenty of.
we
scars
always
to
look
choose
at the
from.
previous scars when we get started, and we try to map out how we can use those best. But at the end of the day, I need to be able to do the surgery safely,
Of course.
and I, and so if we can, we will. But I can't. But there will be some new ones.
So then my other question is about wearing a belly binder. I forgot to put that down, but I did ask about being able to wear a binder and how long I have to wait before I can wear one of those just to get my.
You can wear one the day of your surgery if you want
Okay.
to. I don't. Some people don't like them. They start riding up onto your chest, and they, but I don't mind them. Some people, for a lot of hernias, I give people them. For this one, you can go get one before the surgery. Just go get one you can get on Amazon.
And that was going to be my next question. Does the hospital supply them? Because I know some people say the hospital gave them to them, or some people had to buy them.
The hospital, we can probably get one at the hospital. We'll have to check on that when we're. I'll write for it that they can have one. They should be able to give you one at the hospital. Just remind me the day of.
Okay.
Or while we're there, and I'll get you one.
Okay.
Usually they can give you one though.
Okay, now here's the thing that I'm sure Heather warned you about.
About the liver biopsy?
Yes.
Yeah, look, we can do one or not do one. So your ferritin level is like twice normal. One of the
fatty liver.
Yeah, so all we're doing with the liver biopsy is taking a little piece and trying to see what's going on with the liver. Especially if I see you're having liver changes. I know you said you knew someone who had issues with the liver biopsy. Was it at a surgery or was it just an
they
investigator?
specifically went in for an
So that's different. So that is when they do a liver biopsy by a GI doctor, they go under ultrasound and they put a needle directly into the liver and pull out a piece, and that they can try to cauterize it on the way out, but they're not even looking at the liver. Like, I'm staring at the liver. I'm there, I'm controlling the bleeding, and so I don't have to do it. This is just giving us information on what the status of your liver is. So typically when people's liver function starts going up, and then the ferritin's up, it's probably just related to all the autoimmune issues and chronic inflammatory issues you got from the lupus and everything else. And so ferritin can be up for a lot of reasons. One of the reasons can be from hemochromatosis, where it stores iron in your liver. And you've had this fatty liver disease as well. All I was going to do is just take a little piece off of it, and it cauterizes immediately. I've never had any issue from the liver biopsy, but if it's going to cause you
anxiety,
there's nothing on your liver numbers actually look good. So I don't think we have to do it. Now, certainly if I saw something at surgery that I thought we should do it, we would do it. But if you're kind of against me doing it, I don't have to do it. It's one of those things I was going to do to help give you some information.
If something looks weird, by all means, please do.
Yeah.
Something looks off while you're in there tinkering around.
But we don't have, just because the ferritin's up, fatty liver disease typically is better with weight loss. Yeah. I don't necessarily have to do one. And so I was just going to talk to you about it today and see if you wanted me to do one, or if not. When your liver numbers go up, I always do one. But your liver numbers look okay, so I'm not saying we have to do one. And so if it's going to cause, I don't want to cause unnecessary concern. And there's always, you're right, there's risk with doing anything. The main risk of a liver biopsy would just be bleeding, but that's why I do it. I actually do it first because I want to watch it, make sure it doesn't bleed, and I'm doing the rest of the thing, and I'm staring right where we do it, and so by the time we leave, it's usually fine.
And then I assume that you do the leak test while you're.
I do that in the operating room. I do that always.
Yeah, I'm just I'm not really anxious or scared. I've seen people that have complications, but I can only go based on my previous experience, and I've had good results with all of the surgeries that I've had. Unfortunately, I've had quite a few, so I'm not.
Well, again, there's risk with everything. You're right, there is risk with surgery, and you're at a little higher risk because of the immunosuppressants and stuff you have. But there's risk of not doing surgery, and that's the whole balance we're trying to lay here.
Yeah.
And I think you were very reasonable. I think your risk is actually very low and overall, and I think you're going to get health problems at the weight you're at.
Yes.
Related just to the weight. Then you throw the lupus and other things on top of it. You really need to get this weight down and keep it down, because that's going to just compound future health issues, and we want to do everything we can to keep you.
And that's what I was
healthy
telling you
shape.
in my
So I think
first
it's very
visit,
reasonable.
that I really wanted to do it, not because I can't lose the weight. I actually can lose the weight. I'm just a yo-yo diet. I can't keep it.
Well, your cholesterol's starting to go up, your A1C's up a little bit. You got these little things that are starting to, they're just going to start being additive, and not to mention the joint issues and all that.
Yeah, that's why I thought that the surgery is probably my best option for right now.
Mm-hmm.
Well, just period, to once and for all, nip it in the bud, get it down, keep it
Right.
down.
And so we'll set you up to stay overnight, and we'll just let you go home when you're ready. And to meet criteria, I need your pain controlled, I need you drinking okay, I need you up and walking around, hemodynamically looking good, meeting all the regular discharge criteria, and then you go home.
Okay.
And if you're not there, then you'll stay. But we'll see how you do.
That was the one question I forgot to write down was, when will I be able to go home?
So I would just plan to stay overnight, bring stuff
yeah,
to
no,
stay
stay
overnight,
overnight, yeah.
and then. But my hope is that you're home by the next day. Most people are home. Some people go home same day. Some people go home the next day. Most everyone's home within 24 hours unless there's a reason that you're not. But
Okay.
if you're not meeting criteria, then you'll stay. But
Okay.
we'll just take it. We'll just see how you're doing in the morning.
Okay, cool. Sounds good to me.
Sound good?
Yes.
Any other questions?
No. I'm fresh out of questions.
Oh.
Thank you.
All right. Well, you can head on over to the